Ladies and gentlemen, I welcome everyone for today's CME program. Now, I will welcome us.
Good afternoon, friends. In fact, we are very thankful to Doctor who has come here for giving us on Shingles. Of course, we must thank the GSK who have taken this initiative. In fact, herpes zoster, ஒரு மாதிரி பயம் எங்களுக்குலாம் ஒரு கேஸ் பார்த்துட்டாவே really scared. பட் எனக்கு வராது அப்படின்னு நமக்கு ஃபீலிங் இருக்கு. ஆனால் வந்ததுன்னா பேஷண்ட்ஸ் பார்த்தானா one of the most painful after delivery, I think herpes zoster and renal kidney are the most painful conditions. Full of painful conditions, herpes zoster. Aki, which is very, very popular now. Of course, I still remember those days in 1970s and all that.
Tension violence.
Tension violence. Those days, my time they used to put some yes, humus, correct. After slowly we've seen tension virus, and then now a lot of other creams and all have come. So it's one of the diseases which is deadly. Of course, chicken pox is said to be a dormant chicken pox if we have. I think it is only herpes zoster is only in adults. In children, I don't think we get. I've never seen a child getting herpes zoster. Because we get chicken pox virus, we get chicken pox only. So this is a variant of the chicken pox. Of course, you all know that affects only one nerve. Mostly, it is only senior citizens who get it. That is why it's a big problem. And most of us here are above 60 years. So we have a very high chance of getting this. I don't know whether we have a chance, but I don't know. Maybe you should tell us. Only if I get chicken pox when I'm young, I'll get shingles later, or without chicken pox, I'll get it. So that question has to be addressed. Because I had chicken pox when I was young. So I have probably I have a dormant virus sitting somewhere which I can get it. Okay. So it's a very, very painful nerve root thing. Why it remains dormant for such a long time is still a mystery. I don't know why chickenpox virus stays dormant for years together and suddenly manifests as shingles is still a mystery. Maybe of course there's a lot of treatment now. Of course, a lot of treatment which you're going to tell me what are the things and all that stuff. But prevention is one thing which is better. Like children learn the prevention na we don't treat polio now. It's all prevention. They're like adult vaccination. It's become a big thing. Pediatrics they had a lot of vaccine. But adult vaccine now we have adult vaccine given in my clinical pathology because we have 4 or 5 vaccines which we give protein. And one of the vaccines is shingles vaccine. Of course, we'll ask Venkatesh to brief to us. Venkatesh or one of the GSK people to brief to us about the vaccine and things like that at the end of the session, sir. So let me introduce our speakers, Dr Srivatsa Anathan, MBBS from Gulbarga University. If I remember, 1989. We finished in 1975, sir. So 1989. Of course, fellowship in diabetology and from UK. With the certificate, he's a certified diabetologist, WHO certified diabetologist, which is very, very good. Has postgraduate diploma in diabetes research from Middlesex University. Senior consultant in Isabella Hospital, Fortis Mother Hospital, now known as MGM Hospital and Apollo Spectra. Practices at Shri Clinic at Adayar, Besant Avenue, Adayar Diabetes Center. Has numerous publications in international and national journals and has numerous live membership in most of the diabetic and international overseas diabetic association. As a faculty in the Medi University and initiative from Apollo. So with these words of introduction, let me welcome you, sir. We're really looking forward to how we could prevent this shingles. And is it such an important disease to be prevented? Because now, my clinic, when I ask them, do you want shingles? Shingles. Akina shingles. Fluke, but shingles, how important it is. Only as a physician we should be able to realize and tell them. If we are convinced of giving shingles, then they take it. Probably it's really expensive, but we'll have to convince them. Probably we'll have to do more marketing than GSK to the nation. That's what we have to do. So over to you, sir. Please come on. Now let me ask Dr. Sanshekar to honor our speaker.
Thank you, sir. I'm here to talk of the prevention of shingles and how to take it of shingles. Yeah.
But maybe we can ask.
Yeah, you have antiviral therapy.
Yes.
That is this is basically I thank GSK for asking me to give a talk.
Use the mic, sir.
And I thank IMA Venkataeswara Metro to giving the opportunity to give a talk on this. Shingles is a common problem seen by everybody in this August audience. Everybody must have seen at various stages. But it definitely occurs at people who are above 45-50 years of age, immunocompromised patients or diabetic patients are there, and those now on renal transplant, people who on long-term immunotherapies or steroid therapies for various reasons are susceptible for developing shingles. It is basically very painful, and how we go about it is basics, impact of shingles, design, and integration in practice. It is a herpes family, and as Dr. Kailash has already written, it stays dormant in the nerves, and once usually between November to January, February is the reason why we see a lot of herpes zoster in our practice, and then again it comes down low, and again this season, winter season, we see the eruptions of herpes zoster more. And it is basically abundant glycoprotein is expressed on the surface of the virus, and glycoprotein E is which antigen is used in Shingles.
So one question I asked, this herpes T can once it comes, is it permanently curable?
No, you can have a recurrent episode in the same patient at a different site.
That is great.
Basic problem with this zoster is pain, and some people get into a great depression and pain linger on for months. I had patients for 2 years. He continues to have patients, especially very old people. This vaccine technically does not prevent the occurrence of the virus zoster. It reduces the intensity and thereby reduces the post-herpes.
So you can still get herpes
Yes,
after
like
taking
when you say you get BCG vaccination, you can still get tuberculosis. It's similar to that, but its effect is milder.
pain less.
Yeah, definitely. Once it is mild, automatically pain is milder, shorter duration, recovery is faster. Most herpetic neuralgia or post-herpetic zoster lingers for minimum 3 months to 6 months. So these are the rashes that everybody must have seen in various clinics, but definitely not in children. This is chickenpox seen in childhood. In adults, reactivated when you get herpes zoster. So it can occur in the face, back, eyes, arms, any place, but commonest in the face and the lower back is the place where it occurs commonly. So all of us, the immune as child, we are all immunized for the basic vaccinations, and as we grow older, our immune responses keep coming down, and upon which you develop diabetes, or we are all living longer. As the years have gone, we are all living in life expectancy in India is around 69 for men and 72 for women. So, if you see the immunosense affects several different immune cells, beta cells, NK cells, memory T cells, and thymus. Thymic involution, progressive. So these are the cells that are involved in immunity of our body. And if you see the epidemiology in the global data, worldwide incidence is 3 per 1000 to 5 per 1000 per person years. Risk of developing post-herpetic neuralgia in patients with herpes zoster is 5 to 30%. Recurrence is around 1 to 6%. In our population, it is over 50 years of age, 15 to 81%. Herpetic neuralgia is around 10 to 54%. And comorbid conditions are frequently predisposing. Burden of shingles increases with age and comorbidities. Most of it, the diabetes is major immune modulated condition where patients are susceptible to developing the shingles. So, again, this is just to reiterate that in an immunocompromised, people are susceptible for getting shingles. Basically, from acute pain to a chronic pain, it keeps hovering on. During an acute attack, the pain is acute, and after the treatment of 5 to 10 days is over, post-herpetic neuralgia continues in most of the patients for about 3 to 6 months. So, other complications are debilitating, fatigue, anorexia, weight loss, reduced mobility, physical inactivity, insomnia, withdrawal, isolation, attendance of lower social gathering, loss of independence, change in social growth, depression, anxiety, emotional distress, difficulty, and these are the things that can happen to the individual. It can lead to a different spectrum of serious complications like encephalitis, aseptic meningitis, disseminated. There's something as disseminated zoster also can be seen, where you can have multiple lesions everywhere. I have not seen so far, but this possibility is there. Keratitis, scleritis are common complications seen with herpes zoster. So, treatment options are limited to suboptimal in managing complications. So, usually we start off with antivirals, acyclovir or whatever, given for dose of 5 to 10 days we give. And the rashes, currently we have xylopane gels that can be applied over them so that the pain is reduced. Pain is the main thing when they complain when the rashes are there. And the gabapentin, all diabetic neuropathic drugs are helpful in management of this herpetic neuralgia. Who is at risk? Women, family history, stress, COVID, positive, HIV, malignancy, post-surgical, steroid usage, cardiovascular patients, respiratory condition, and diabetic patients are all at risk. And rheumatoid arthritis, SLE, and ILD patients are all at risk of developing. So, association between diabetes and herpes zoster, these are various studies show that post-herpetic it is associated more in diabetic patients when compared to other people. So, we have more people living with a lot of diabetes in our population as we grow old. So, definitely the association is much more. Shingles is associated with increased risk of cerebrovascular and cardiovascular complication. These are studies to show that there are association effect on stroke and follow-up study, and highest risk in the first month. But practically we have not seen much because of herpes zoster getting into cardiovascular or neurological issues. So COVID patients are definitely immunocompromised, and they will definitely are susceptible for herpes zoster. But per se COVID does not precipitate herpes zoster. So how this is designed is an antigen glycoprotein E, as I said, because the virus contains that, and because of this antigen, it is given in 2 shots, one after 2 months to maximum 6 months is the dose. And studies have shown that
For herpes.
no, sir, it is not being
It was the same virus.
slightly different. This is based on the outer glycoprotein of herpes zoster. But people, adult who are going to US, I have not seen, but this is different from the other vaccines. But chickenpox vaccine is a live so, Shingles is thoroughly investigated in large pivotal phase 3 clinical trials and found out that the primary objective was pooled analysis data over 70 years of age were major patients who were used, and 17,000 subjects were studied. It definitely prevented development of shingles in these patients, and dosage schedule was 0.5 ml in 2 doses after second month within 6 months was given.
But how long does it give protection? Like
10 years. 10 years. 10 years.
So
Studies are for 10 years.
So 2 doses for 10 years.
Yeah. And the cost is around, the MRP is around 11,000. Wholesale, you'll probably get about 2 to 3,000 rupees lesser. And it delivered an efficacy of 90% against shingles patients over 50 years of age. So these are just to say that Shingles vaccine is effective in controlling occurrence of shingles, and basically to prevent post-herpetic neuralgia is a major aim in this. So it up to 10 years it produces an 89% efficacy. That's why I said even if you have vaccine, it might come in mild patient. What are the adverse reactions? As far as I have used the vaccine, there is a site injection pain, fever for 1 day is there, that's all. Mostly these are the only seen what in about 25 to 30 patients I have used. These are the things that they have reported. Local reaction is a site injection pain, and 1 day fever is what is there. So these are various studies to show that it has been effective in HIV patients, diabetic patients, immunocompromised patients, and it is currently approved in most of 24 countries, and 50 approvals are there for the usage of Shingles. It can be used in adults aged above 50 years, irrespective of prior receipt of varicella vaccine or episode of herpes zoster. Does not require screening or history of chickenpox. And chronic medical conditions such as renal failure, diabetes, rheumatoid arthritis, chronic pulmonary disease, and can be used in adults. Asthma can be also given this. So several countries have specific recommendations on immunization of people with diabetes. So American Diabetic Association says diabetes recommended 2 doses of people with diabetes above the age of 50 and prevention and previously vaccinated also. So 23 gold line recommendation of shingles vaccine for COPD patient is again saying use routine vaccine for above the age of 50 years. So this is how you should use 2 doses, one between now and then 4 to 6 months. So you can wait for 6 months also before you have a second dose. That's the last statement, sir.
But what is
it is not a prevention of primary vesicular infection. It does not prevent chickenpox.
You don't give this in
It is only for adults.
How do you decide? How do you decide the second dose between 2 to 6 months? Can you put an ideal month or why the 2 to second range?
The immunity response.
So we need to wait. How often you use second month and which patients will use 6 months?
Currently, after the second month, it's convenience of the patients to come back. That's all. Because it's still in an experiment. Like, hepatitis B, where we have now, after 1 month later, then 6 months later, 4 doses we give, 3 doses we give, hepatitis B vaccine. So it is given for first month.
So for COVID and all, we had first dose, then we had after 2 months, 6 months and all we had.
So this is
Specific our treatment.
no specific date, sir. This is just we are experimenting, and he will be able to clarify.
Once your the presentation is over, I will take those questions.
And the other question was, like in COVID, people started all realizing now it had developed myocarditis and the reactions consequent to COVID vaccination. Or anything of that sort in this vaccine?